Welcome to Let's Talk Jonesboro. Today we have with us Dr. Shane Speights, and he is the Dean of the NYIT at A-State Doctoral University. Tell us a little bit about that. Welcome, first of all.
Oh, thank you. Thank you
Dr.
for having me.
Yes, and now what you're doing now is graduating your first class.
We'll be graduating. We're seating our fourth class. So what we're doing now is it's a 4-year program. So it's a College of Osteopathic Medicine. Just like any other medical school in the nation, it's 4 years long. So we're starting that fourth class now. Can't believe it's been 4 years.
Wow.
But yeah, starting that fourth class this August. So we've now seated that full class and are working on the wait list. So it's 115 students per class. So we'll be a total of 460 students starting this August. So the first class that we started back in 2016 will graduate in the spring of 2020. So that'll be a big deal. We'll have a lot of people in town. A lot of students will be excited, be graduating that first class from the 2016 group.
That's fabulous. And you know, we celebrated and had a big day when Wilson Hall opened, and you were preparing for your first class of students. Can you go back to that time, or even to 2012, I think, when you first started pondering this possibility, and tell us some of the milestones along the way that stand out to you?
Oh gosh, just thinking back when all of this was evolving from an idea to the $12.5 million renovation of Wilson Hall, a historic building there on the ASU campus, that we're just excited to be our host for our medical school in the center of a beautiful campus in and of itself, right there in the middle of an undergraduate campus. I mean, truly the stars aligned on multiple levels. Between the administration at Arkansas State University, the administration at NYIT, all of the stakeholders and all of the supporters that we had, just here, within the city, within the chamber, all of the physicians and hospitals in this region and in this state that have kind of come forward and been a part of the process. It truly is. I mean, it's amazing just to look back now on the 3 going on 4 short years since we've started, and knowing what that impact's going to be 5, 10, 15, 20 years from now as these physicians start moving out, getting their additional training, and hopefully start practicing in these areas of Arkansas that so desperately need physicians.
And this was the concept that rural places, not just in Arkansas, but in the Delta
Absolutely.
at large, need physicians,
Right.
easy access to physicians.
So from day one, that was the mission of the school. We recognized, it was real interesting. Luckily there was a visionary at NYIT, because so many people say New York. How did we get a New York school,
Right.
here in Arkansas? At that time, the vice president was Dr. Barbara Ross Lee, who had a fondness in her heart for the underserved and the rural populations. She's actually from Michigan. And so she saw the opportunity here, and partnering with Arkansas State University. Dr. Jason Penry was instrumental in bringing that together in terms of actually going up there and meeting with Dr. Ross Lee in New York at the time, with Jeff Hankins. They, as the ASU delegation went up there and pitched this idea to them, and she said, I see the need and we want to be a part of it. So then to come down here and just create a medical school based on the need. In Arkansas, we rank toward the bottom in terms of number of physicians per capita. No surprise that correlates with our poor health care outcomes.
Right.
We're number 3 in the nation in terms of cancer deaths. Number 5 in terms of premature death, which means that people here in the state of Arkansas die at a younger age than other states. We rank at the bottom in terms of ability to have good preventive health care services. So the only way to fix that is to get more doctors into these needed areas. And we kind of feel like we have a recipe to be able to fix that. So what we do at our medical school, which is different than other medical schools, we require our students to spend time in these needed areas. So medical school is 4 years long. And for every medical school, the first 2 years are spent within the building, learning gross anatomy, listening to lectures, going through labs, really doing a lot of the hardcore book work. Years 3 and 4 are spent out in the communities with the physicians and the hospitals and the healthcare organizations. We put our students strategically in areas where they are needed. Mena, Arkadelphia, Wynn, Pocahontas, Piggott. We specifically put them out into these areas to get that exposure to those rural health environments. there's great medicine being practiced by great physicians in these areas, really the front lines of medicine. So having our students be exposed to that was the idea from day one.
Very nice. And this should shorten the wait. I guess explain, if you have a DO degree, explain, is that a difference? Should people feel any different about that from seeing the doctors that they have seen for 30 years?
Right. Well, obviously I've got a little bit of a bias. I think that they're going to feel better about that.
We got a better doctor.
So there's two types of physicians in the United States that can practice unlimited medicine and surgery, and that's an MD or a DO. Many times patients don't know the difference, nor do they recognize if they've seen a DO or an MD. Whether it be a radiation oncologist, an ER doctor, a general surgeon, a pediatrician, MDs and DOs practice both of those, and they can go into all those same specialties. A DO can be a dermatologist, a neurosurgeon, an ear, nose, and throat doctor. There's no restriction on that. Most patients would probably have to look to see whether their doctor truly is an MD or a DO, because you can't tell the difference. Now, within the training, in terms of the time spent in the medical school, DOs spend about 200 hours or so learning about the structure and function of the human body and how it relates to itself. And what that is in terms of actual dysfunction of the joints, the muscles, and the ability to relieve that dysfunction. That's part of the osteopathic curriculum, which is not in a typical MD curriculum. So really, it's additional training beyond what you would get in a typical medical school.
And so you've got students coming through that, and I've met some of these students, and they are brilliant. They impress you. It's great to have them in Jonesboro. Just imagine the overall average IQ. I mean, you know, I'm holding Jonesboro back. They're setting the bar high, you guys, and so it's cool to have them in Jonesboro. It's cool to have them at Arkansas State University. But what's this going to look like? I mean, how can they filter out year by year by year, and how many students compose a class and then the entire college?
So we've got 115 students per class on average, and that puts you at about 460 students total. And 80% of our students come from what we call our targeted market, which is the state of Arkansas and pretty much any state that touches the state of Arkansas. So we're trying to recruit just from this region of the nation. Because we know that those individuals will be more likely to stay here and practice medicine. So that's kind of how each class varies a little bit. Maybe we've got 48% female one year, and maybe it's 48% male the next year. So there's a little bit of variation, but in general, that's kind of how the class is broken down. And we recruit from all over. Like I said, we truly try to recruit from the state and from really states that touch Arkansas.
So how many applicants will you have? Like, how many applicants for your next class do you have?
So we get several thousand applications for those 115 spots.
Wow.
Our acceptance rate is about 6%. So the national acceptance rate varies between 7 to 8%. So we're a little more competitive in terms of students that we take. Because we're a private institution, we get applications from all over the country. So we try to filter those out and try to focus in on really the demographic of the type of student that we want to come here and hopefully practice medicine. Now remember, 4 years of medical school is just the start. So you had to do an undergraduate degree. Typically you got a degree from ASU in biology or chemistry or something like that. Then you come to medical school, do another 4 years, and after that you can't practice medicine. You've got to do a minimum of 3 more years in specialty training before you can actually go out and practice medicine. So pediatrics, emergency medicine, internal medicine, family medicine, those are all a minimum of 3 years of additional training. And one of the pieces of the puzzle that we've been working on is creating those programs. So NEA Baptist, for example, they started an internal medicine residency program right here in Jonesboro. St. Bernard's has also started an internal medicine residency. Those are basically opportunities now for our students to stay here in the city of Jonesboro and do additional training to become board certified in internal medicine. There was already a family medicine program here that I went through myself, which was a phenomenal program. But now as we add more of these programs throughout this region of the state, that will offer more opportunity to keep physicians here. What I think is neat is that truly, right now today, a baby born in the city limits of Jonesboro could go to school within the city limits of Jonesboro, go to college in Jonesboro, go to medical school and additional training, and never leave the city. And so you could become a board certified physician in internal medicine or family medicine and never leave the city limits of Jonesboro.
That's a fantastic statement about the growth of Jonesboro and the partnership with Arkansas State University and of course NYIT being the critical element in this role. Tell me, I don't want you necessarily to call students names because you'll forget one unless you're just that much smarter than me. But tell me some of the things you've seen, because as you open this, even though you're the doctor, you're the dean, you're probably seeing things that inspire you in students, and I would like to know some things that you've seen.
We early on, one of the things that we recognized was that graduating medical students, graduating physicians to practice great, excellent medicine, that's the bottom, so to speak. We consider that's just a given. What else can we as an institution do to help the communities, to help the state, to help the areas and the regions that we're partnering with? And so in terms of outreach programs, that's been priority number one for us, is how can we start using the intellect and the wisdom and the excitement of all of these medical students that we have now? How can we start using that even before they graduate? So we've got one of the great programs that I love to speak about is Project Heart. Project Heart is a program where we will take students in their junior and senior year of high school, and so basically they come in for a 3-day, 2-night camp on the ASU campus. And they learn about healthcare, they learn about health outcomes, they learn about different populations, they learn about what it's like to be in medical school. We partner with the ASU Health Sciences, so they talk about physical therapy, nursing, occupational therapy, radiation technology, all these different opportunities in healthcare in terms of the profession you could go into. But there's a bonding that goes on. The reason why is because our medical students are the camp counselors.
Oh, is
and
that
so
right?
Those are the ones who actually provide the mentorship to these young junior and senior high school students. And so we're very proud of that program. Right now it's about 40 students per class. We actually are taking applications now. We've got another program called Structure Function Technology, where we bring in about 110 different students from, again, this region, from high schools in this region, and they learn about the technology and how we use that to teach our medical students, specifically in the anatomy lab. And so they'll learn about how we use the iPads and how we will use video technology and how the students learn the human anatomy through those technologies. So then we'll put the students actually in the gross anatomy lab, and our students will help teach them different areas of a dissected cadaver. So, I mean, it's certainly an opportunity that wouldn't exist otherwise without a medical school being here.
And you guys have, I know in Wilson Hall, I've been through it, and at first it's fun to watch kids, young adults, sitting, standing, leaning, curled up, lying down, studying everywhere. But you also have basically doctors' offices, hospitals. You've got
The simulation lab.
the simulation.
Absolutely.
It's unbelievable what's in this hall now.
So medical education certainly has made advances in the last 5, 10, 15 years or so, and really we're kind of on the cutting edge of that. We have 10 exam rooms that are wired up with microphones and cameras, and we record every interaction that occurs there between the student, and we actually hire standardized patients. So if an individual watching this program wants to come be a mock patient, then they can come and apply with us and actually be a mock patient in front of our students. They'll memorize a card and they'll act out a scenario. And so then the students will then learn how to react to the way that the patient reacts. It's far better for them to do that in this controlled setting than when they get out there. And so this is education kind of on the cutting edge, where we're trying to give it to them as soon as we can. Having that conversation about the diagnosis of cancer, or how to better yourself through diet and exercise, or discussing a sick child. It's better to have that in a controlled situation where then you can critique the student and say, I don't know that I would have gone down this road, or I might have said this a little differently. that's the best way to do it, as opposed to having them learn on the fly with real patients. So that's why we do that.
And that's brilliant, because that's the bedside manner that we all expect and,
Right.
really hope that our doctors are better at that. That's as critical almost as the care in some cases. So that's really good that you teach that. And speaking of teaching, you have brought a lot of other good people here who are teachers
Absolutely.
to Jonesboro. How many teachers do you have?
So we have our total staff and faculty right now sits at about 82, and so we have a full complement or a budget complement of about 27 faculty that we'll be hiring in once we're fully up and running, which will be next year. But to your point, we've brought in microbiologists, biochemists, neuropharmacologists from Arizona, South Dakota, New York, New Jersey, Virginia, Florida, literally from all over, Texas. We've recruited in and continue to recruit in very talented individuals to complement our already excellent faculty.
They are excellent, and I've met some of those too, and they're just brilliant, and they're assets to the community because they want to get involved in the community and not just hide out at the university. They get out and they change Jonesboro and uplift. And they even want to serve Jonesboro. A lot of them have participated in civic service, and it just can't be better because of that.
And that's a piece too that we want to make sure that we ingrain in the education of our students, that servant leadership. Again, I've said this earlier. I think for us, we consider it just the standard that we're going to graduate excellent physicians. But we want physicians who will become leaders in the community, who will be advocates for their patients and for their population, those that will really be involved in the health of the region. And so that takes time and that takes work. We require all of our students to go through a population health certificate program where they learn about disparate populations, they learn about health policy, they learn about the management of large populations. And so this is information and education that otherwise they wouldn't get at another medical school.
It's truly a remarkable amount of work that's gone into this, and you guys do a fabulous job, and we're so proud at the city of Jonesboro and as residents of Jonesboro of what you do, and we thank you. This is Shane Speights. He's the Dean of Osteopathic Medicine at NYIT at Arkansas State University. Thank you, Dr. Speights.
Thank you.